Hey, future nurses, are you stressed about getting your license? Here at Remar Review, we believe in faith over fear. I'm Regina Callion, the #1 NCLEX instructor in the world. Tune in to Remar Nurse Radio on Spotify and Apple Podcasts for new episodes every Thursday. We got that exclusive content. You don't want to miss it. We can, we will, we must pass NCLEX. Remar nurses, we are getting ready to begin Monday Motivation. Oh, this is Monday Motivation. It's our favorite time of the week around these parts because we get to come together and do what we love the most. And at this time, the most that we love is NCLEX. So it's our main priority. So if this is your first time here, welcome. This is Monday Motivation / Let's Talk NCLEX, and you are right on time to start the program with us. Hello, everyone. We have a great program for you today. If it's your first time joining us, my name is Regina Callion. Yes, I am back. I happen to be the #1 NCLEX instructor on the planet. It's a self-title, but I'm walking in it. I'm walking in it by faith. The #1 NCLEX instructor on the planet. I say that I'm that because I honestly have the #1 nursing students on the planet who demand the very best in education. They demand the very best in nursing resources and information. And so we built this whole team, the Remar team, not just myself, but the team that is serving you guys here at Remar Review is phenomenal. And so here we're a family. At today's Monday Motivation, you're going to be so happy because the Monday Motivation topic, shout out to everybody, is it's not about the money. It's not about the money for you. And you know what? This reminder is so, oh my goodness. This reminder is just so pivotal as a life lesson. It's a life lesson because if you think that you are going to do nursing for the money, you are totally wrong. You are totally wrong. You already know that. If you are a nursing student, you know what you will have to go through in nursing. You know what you're going to have to deal with, and the money is not going to be worth it. So it's not about the money for you. It's about something else, and we're going to talk about what that something else here is today on Monday Motivation. Hey, everyone. Good afternoon, good morning, good evening, good night, wherever you are. Come on in. This is the start of Monday Motivation. Something else that I want to show you guys. I love to start Monday Motivations with a blessing. And the blessings come right from the Remar family organically. So we have Nurse Marlena, RN. She is the type of Remar nurse that we love to spotlight because literally from the very beginning of her nursing program, she connected with Remar and she has been studying with us throughout. There she is with the original Quick Facts. But our Facebook Lives that we do, the YouTube, she subscribed to the YouTube channel. She joined the Remar Nurse Facebook group. Guys, this is the difference with Remar. This is the difference. We celebrate your successes and we do it in a very genuine way. Like it's not about, and I had this conversation with a nursing student and she said, she was like, she wasn't happy. And she wasn't happy with me, which I don't get where most of Remar nurses, they're happy with me. But this one particular nurse, she wasn't happy with me because she asked me about a question that she had saw outside. She was reading, she was coming along and she saw a question. And so she asked for the answer to the question. And you guys know me. You guys that know me, you know what is my thing. What is my thing when people say, Regina, what is this? You know, what is my thing? My thing is to tell you guys to look it up, seek it out independently. You're smart enough. You need to invest into the information. If I tell you, you won't remember, but if you look it up, you will remember, right? And so when listen, Amanda, you know it. Amanda knows it. She put it up there. So when that was my response to her, she said to me that if I was a child of God, that I would respond to her. That if I was a child of God, this is a conversation we had. If I was a child of God, then I would be providing answers to nursing students no matter what. And so I'm saying this because this is my first time really being confronted in that way. And so I had to make the response that, as an instructor, I always have to do what I think is best for my students at that time. And as a child of God, I have to know my limitations, and I have to know where I can be of service and where I cannot be of service. So I want you guys, I'm saying all this to say that here at Remar, we are very genuine and authentic. And whatever types of conversations that you guys want to have with us, we will have with you. And we like to keep it real around here. So when you come into this community, we are not going to baby you through the process. We are going to give you what you need at that time based off of our experience. And this process of studying for NCLEX, preparing for this exam, requires you to have a very strong core, a very strong foundation, and somewhat of a thick skin, because there's going to be challenges and obstacles in your way. And so I'm saying this as your instructor, that I want you guys to take your responsibility today for what you need to do to make sure that you get the information, okay? Because I'm a guide, but I'm not a genie, all right? I'm here to help motivate you guys to get that information down. Whew. Yes. All right. So let's get back on the grind. I love this. When nursing students find us in the beginning of their nursing program, then it allows them to take advantage of all of the free resources that we have. So here we do weekly lives. We do Facebook study groups. Yes. I love the Facebook study group. YouTube, you got to get in that Facebook study group. You got to get in there because some good things happen. Also, don't forget, we love the testimonials. So pass NCLEX, tell us your story. And right now, we are actually doing something. We are giving it out. We're giving out this amazing gift, and it is the cruise for two. And you guys know I just came back on a cruise. I just came back from a cruise, and it was an amazing vacation, right? It was an amazing vacation. And so we are celebrating a Remar nurse who has passed NCLEX using Remar Review and sent in a video testimonial. So we're receiving these video testimonials, and we're going to pick a winner from the video testimonials. And you guys know you're not only going to get a cruise for yourself, but you're also going to be able to take somebody else on that cruise with you. You also get your flight paid for down there. Your $500. We're giving you $500 to spend on that cruise. And when you're on a cruise, even though they say everything is included, it is included. Trust me, the food and everything, the entertainment. But you might want to buy pictures. You might want to buy some souvenirs. And so that $500 is going to come in handy. Oh, I wish I could win it and go on a cruise again. So I'm excited to see who the winner will be and how much fun that they're going to have on the cruise. So one more thing, I have a very special guest that's going to come on today. And you guys know 90% of the time, my special guest is the same person for you guys. So who is my special guest today? Can anybody guess who the special guest is that I'm bringing on today? One of my favorite people in the entire universe is going to spend some time with us today at the end of the broadcast. Did anybody guess who the special guest was today? Yes, Christine. Nurse Christine says Mark. Okay, so Mark is going to come later on into the broadcast to talk to you guys. I want to reference this. We're having a once in a lifetime NCLEX sale. And this sale is, it's just for those who, we just want to encourage you guys who have not committed to the 6-week challenge. And the once in a lifetime NCLEX sale, you hear more about it later on, but essentially the longer you've been out, the more you'll save. So we're just looking for ways to continue to be a blessing. We have the cruise, we have all of the free things that we're giving away and the free promotions that we're doing. But Remar nurses, we love you guys so much. And I know that it is difficult for you to get back up on the horse after being out of school for so long or failing NCLEX. So the once in a lifetime sale is going to introduce you to something that is super amazing. It's something that's really new. We haven't been talking about it. Well, we've been talking about it internally in the office, but not so much to you guys. But we're going to be introducing the ultimate NCLEX success package. Hearts on the screen if you are excited about what the ultimate NCLEX success package is. Oh my goodness. You guys, it's something that you've been calling for. The ultimate NCLEX success package is that program that will take you throughout your journey to the next level. It's Ultimate NCLEX Success Package. Shout out to Maureen, named it this program. And I am super excited for you guys to get rolling into it, get introduced. I'm introducing it today, the Ultimate NCLEX Success Package. Hey, remarnurse.com is my website where I put all of the resources. You get the testimonials, the inspiration. Team Remar is waiting for you right now. Come on in. Remarnurse.com. We are just getting started with Monday motivations. I see so many hearts on the screen. You're loving that Ultimate NCLEX Success Package. Okay, so our Monday motivation topic, we're about to get into it. Our Monday motivation topic for today is, it's not about the money for you. It's not about the money for you. And this topic for me has been a driving force for my entire nursing career. Okay. Working just for money is a bad idea. You have to have a deeper purpose for what you are doing. And it really doesn't matter if you're in nursing or any other profession, but we're here talking about nursing today. So working in nursing for the money is not what it's about. So I have this here, just two points for the problem with working for money. Number one is, it's this, like, when you're just working for money, you will never make enough. Okay. You will never make enough money for what you will have to endure, especially in nursing. If you don't love it, if you don't love nursing, you are going to hate it. I'm telling you. And it's no amount of money that will keep you there. And that's one of the problems that we're experiencing in nursing. Yes, there is a global nursing shortage. Literally, you can go to every continent on this planet and there will not be enough nurses. You guys know that nurses are graduating and they're passing NCLEX and they're getting their dream job and they're working. But then once they get their dream job, they realize, oh, this isn't a dream at all. This is a nightmare. The rotating shifts, like, right? You day shift 1 week, night shift the next week. You come in, the patients are sicker than they were, than the mannequins that you treated in nursing school. These are real patients. They're actually sick. They're heavier. They're bigger. You're pulling them. You call for help. Nobody comes. This is nursing. I'm painting you guys the picture of the other side of nursing, right? And then they call you. You're the pharmacist. You're the housekeeper. You're the dietitian. This is the nursing, right? And so you get into nursing, and if you don't have a genuine passion for helping people, that $19 an hour, that $20 an hour is not going to keep you there. It's not going to be worth it. It's not going to be worth it. $20 an hour is not worth a doctor yelling at you in front of everybody. $20 an hour is not worth somebody throwing up inside of your scrub top. It has happened, okay? $20 an hour is not worth you contracting tuberculosis, HIV, some other communicable disease in the hospital environment. It's just not worth it. So if you think that you're going to just work for money, it will never be enough. The money is not worth it. I'm telling you guys right now, the money in nursing, as good as it is, and it's good, it's not worth it if you don't love if you don't love nursing, if you don't love to be a nurse, if you don't love to have that responsibility, because the responsibility of somebody's life in your hands has no price on it, right? You can't get paid for that type of responsibility. It's like you have to be self-motivated. You have to be able to pay yourself with your own kind words. One thing about nursing is that you don't get rewarded for all that you do. Okay? You don't get a pat on the back every time you save somebody's life. And sometimes your supervisor may not even be in the building and you have done the most. Okay? So you got to think about that in that way. So ask yourselves during this Monday motivation, why are you doing this? Why are you on this journey? Why are you here today? What are you looking for? When you become a nurse, what are you expecting to get out of it? Because it's not the money. The second thing I want to say is that the problem with working for just money is that your stress level in general is going to increase. All right. Your stress level in general is going to go up if you have a singular focus of trying to create money, save it, keep it, chase it. And I find that in nursing, it happens if you get into a rut where, like, you might experience this on a micro level. Like if you're trying to save up for maybe your kid's Christmas or something, or a birthday or a vacation, and so you're working overtime, you're trying to be at the hospital picking up those weekend shifts, those night shifts. You are so tired by the time that paycheck comes that you can't even enjoy it. You don't even enjoy your stress level because you're constantly on the job chasing that dollar. Your stress level goes way up. So I like what Aoife says. She says, call bells going off by the seconds. You are running all over the place. She's setting the scene for us. Not enough time to document. You got a full bladder, headaches, the list goes on and on. If you don't have a heart to care for people, don't go there. She says, I'm a student trusting God to be a nurse soon. So exactly, like you're a student and you understand that that's going to be your day-to-day life. Like, yeah, if you're a nurse, and you're working, don't expect to take lunches. Nurses don't take breaks. Remember when that lady said that nurses were sitting around playing cards? Like the whole nurse nation just like lost it, because that's like the last thing that we have the time to do. Like nobody is pulling out a deck of cards. Nobody's doing that, right? So your stress level increases when you try to chase money in nursing. And you can see it. You can see it on the nurses' faces, the ones that have been there for too long. And I'm telling you guys this right now. In your nursing career, never feel like, oh, you're settled. Always be looking for how you can advance in nursing, because there is the possibility of doing that. There's a lot of nurses who outgrow their unit or who outgrow their position. And it's simply a matter of, when you gain so much experience, when you gain so much knowledge, but yet you fail to progress to the next level, what happens is you become very cynical. And I think this is the root of the problem with nurses eating their young and not being, not being willing to teach, is because you've been a nurse, you've been a regular floor nurse for 20 years. You didn't seen it all, you know it all, but you haven't progressed to the next level in your own personal career. So when a new nurse comes in, you can't even relate to that nurse. You can't even remember a time when you didn't know anything. And so you become mean and you become critical of that new nurse. And it's not the new nurse at all. It's you. It's you who should have moved on. It's you who should have been in a teaching position and getting paid to be a teacher, because then you would be more happier. And I'm not speaking to you guys. I'm speaking to the imaginary nurses that are just so mean to new nurses coming in. It's not the new nurses, it's you. And so for Remar nurses, we have to remember that we are always looking to go to the next level. And not only are we looking to go to the next level, but we are willing to help our fellow nurse get there as well. That's the difference. We're here to share information. We're not here to put people down, right? Because we all have different experiences. So I say all that to say, it's not worth it. All right. And Remar nurses, just to remind you guys why you're here, you are not working for the money. You are working for the freedom. Yes, it is a freedom thing that you're working for. Oh my goodness. It is the freedom. Once you have that nursing license, because you're a student now, you don't have your license now, right? But once you have that license, it is access to more of your own time, right? When you use it responsibly, when you're not working for the money, when you're working because you have a passion in nursing, but you also want to enjoy your own life. Nursing allows you to do that in a very unique way. And just generally, for nursing, when you become a nurse, you will get paid more for your time, which is great because that means you won't have to work as much. If you're working 2 jobs now, you become a registered nurse or a practical nurse, you only have to work 1 job. And then you normally get to choose the types of hours that you want to work, okay? Another freedom that comes with nursing is that you get paid vacations and paid time off, which is amazing because that is time that you get to spend with your family, with your friends, working on your own business, working on your next level of education. Like all these things can happen right now for you once you get that nursing license. So you guys know me, perfect example, registered nurse, have my own business. I'm back in school, raising my family, 2 kids, about to homeschool my daughter. You would think I don't have any time, but literally, I'm able to do a lot of things that I enjoy actually doing. And so that freedom is what you guys are chasing as well. It's not about the money. It's not about the money for you guys. It is about the freedom. So I like it. I like this one too, because I think this speaks to where I am. It's not about the money. It's about the lifestyle. Oh my goodness. The lifestyle. And look at this picture. That lady right there, that's me. That's me. That's me. She is living her best life. That's me. And so, when you have money, people think, oh, money is really about the dollar signs. Like whether you're rich or whether you're poor, this all is reflective of how much cash you have in your bank account or how much cash you have on hand. But it's the mentality. And I put this on my Facebook page and I put this on my Instagram. Check out Remar for NCLEX on Instagram. If you're not on there, check out the photos, right? So I put this on Instagram today. Being poor, it has nothing to do with money. It's a mentality. When you are poor, it is because you're passing over opportunities repeatedly. That's a poor person. That's a poor person. And so in your nursing career, you have to understand that it is not at all, okay? It is not at all about the money. It is the mentality, how you choose to see things. Poor people tend to pass over opportunities repeatedly. And I'm not going to get too hard on you guys today, but some of you guys here, you come on here every day. You're watching the lives, you're sitting at home, but you pass over the opportunity repeatedly to join. You pass over the opportunity repeatedly to really get involved and to take your studying to the next level. We have Winning Wednesdays coming up. We have this, like you're participating, you're just watching, but you really need to make the commitment. Get in the Remar family. Commit to something. Let's go. All right. So Remar nurses, it's time. Are you ready for some NCLEX questions? Remar nurses, let's go. Let's go. We got 330 people on. So I'm looking for our share goals. We're going to do 3 questions. Our share goals today for Facebook is 150 shares. There are over 300 people on here. We'll do 150 shares. go ahead, share this video. And then for YouTube as well, for YouTube, we have, we have 180. We have 180 people on YouTube. So we're looking for 80. We're going to look for 80 thumbs up on the videos and we can go. But let's get started with our first question. This is best of 3. Here we go. A nurse is working in the emergency department. 4 clients present needing immediate treatment. Which client is the highest priority? Number 1, the client with varicella who requires immediate airborne isolation. 2, the client reporting breathing discomfort after cleaning for 2 hours with ammonia, rates pain 4 out of 10. 3, the client with a 7 centimeters deep laceration across the leg, partially showing the femur bone, saturating 3 dressings per hour. Or 4, the client with a blood glucose level of 505, experiencing 3 premature ventricular contractions a minute. We are looking for the priority patient here. What do you say, Remar? Nurses, these patients are awfully complicated. They have a lot going on. I see a lot of 4s. I see some 2s. Wow. Here we go. Remar nurses, this is priority. This is priority at its best. If you are a Remar nurse, I got all kind of questions. I got all kind of answers. 3, 2, The comments are coming in. Put your comment down, share this video. We are getting into the meat of Let's Talk NCLEX here. I'm going to give you guys the correct answer because we got to move on. And remember, if you don't get this question right, it's okay. Mark it in your notes because you will not miss it again. The correct answer is actually going to be, hey, number 2. Yes. Despite everything else that everybody has going on, you got to remember airway comes first. What is this patient reporting? They're reporting breathing discomfort after cleaning with what? Ammonia. You guys know how strong ammonia is. It can certainly cause a chemical burn. Yes, especially if you've been cleaning with ammonia for 2 hours. No. You got to watch that. So the correct answer is number 2. Did you get it right? You have to be really careful. I mean, there are some principles of priority questions. Airway, breathing, circulation. You have to be able to identify those ones, even if they are covered up with distractors. So that's what I did for you guys. I covered this up. This is the airway question, but you know how I covered it up? Instead of putting respiratory distress, you know what I put? I put breathing discomfort. Doesn't that make it sound less serious? I put breathing discomfort. And then I gave you a reason why, which makes you rest in, they've just been cleaning. But look at what they've been cleaning with. Ammonia, very strong. And then I put in another distractor at the end and I gave you a small, a very small pain number, right? So 4 out of 10, right? So you guys glossed over that. And then some people, they went down and they picked number 4. And we certainly know that a blood glucose level of 505 is really high, right? It's very high. But when you talk about an abnormal blood glucose level, would that be considered airway, breathing, or circulation? Yeah, that's kind of going to fall into circulation. So it would never come before an airway issue, right? And I think some people pick 3, but 3 as well, 7 centimeters deep laceration across the leg. That is also, even though it's bad and you can see the bone, that's not great. But this is also what kind of issue? Yes, this is also a circulation issue as well. So don't be fooled. Don't be fooled by the distractors. Don't be fooled by the distractors, because that is one way how you can go into the NCLEX exam knowing a content. You can know your content, but you can fail that exam because you're caught up in the distractors, or you let the distractors throw you off of what you really know. So I know there probably were some of you, when I revealed the answer, you said to yourself, I knew that. Of course you knew that, right? But it's the layers of distractors that keep you from the right answer. NCLEX is an exam that everybody on this broadcast today can pass, period. If you have not heard anybody say that to you, I'm saying it to you now. You can pass this test. You can, you will, you must. You can, you will, you must pass NCLEX. Let me go do number 2 here. Here we go. Let's try it again. Okay. Which client should the nurse see first? Another priority question. Number 1, the client who was diagnosed with hospital-acquired pneumonia 2 days ago, reporting chest pain. 2, the client with COPD on 4 liters of oxygen, reporting difficulty catching air after ambulating to the restroom. 3, the client with asthma who is experiencing chest tightness but no wheezing on auscultation. Or 4, the client with cystic fibrosis and a newly developed cough. Oh, here we go. Remar nurses, I am not taking it easy on you today, period. Okay, so here we go. Here is an airway question. Everybody has an airway issue. Everybody here. Everybody. So this is not, airway, breathing, circulation. What are you going to do when everybody has an airway issue? Well, my friends, this is where strategies don't help you. And you have to just know about the content, okay? Because strategies say, okay, well, let's compare the patient. Who has the airway issue? Well, doggone it, everybody has an airway issue. So that's not going to work for us, right? So now if you try to use another strategy, who has a new issue? Well, here, there's a couple people with new issues, or I have no timestamp on what's happening. So now I have to go along with the content that I studied, right? What is the content that I studied? So I see the answers coming in. And their answers are actually looking good, but people are like, hey, I don't know. They said 4 has a new issue. Why is it? So look, so now you guys, okay. And so now what happens is sometimes now we get too deep. All right. So we're going to reel it back in here. I'm going to show you the right answer, and then we're going to go over every one of these patients. Okay. So here we go. The correct answer for you guys. Thank you for participating. Let's do rationales right now. Wow. Over 400 Remar nurses watching this. That's amazing. Okay. Correct answer, guys. Correct answer is number 3. Number 3 is the airway patient who is the worst. Well, how do we know that they're the worst? Well, number 1, they are having chest tightness. Okay. Chest tightness, not great. Somebody with asthma. We expect chest tightness, but we also would expect what? We also would expect wheezing. Yeah, we're going to expect wheezing. So when a client does not have wheezing, but they have asthma, what does that indicate? Oh no, somebody with asthma but no wheezing, that means that there is no air exchange, right? The little bit of air exchange that they possibly could have is absent now. So this is a medical emergency, this client right here. But if you picked number 1, the client who is diagnosed with hospital-acquired pneumonia 2 days ago reporting chest pain. Now, do we expect a little chest pain with pneumonia? Yeah, after 2 days, yeah. You might have a little chest pain because you might have acquired a cough, right? You're going to have some pleural pain there. All right, so that's not going to be your priority at this time. We don't have any indication that this patient has respiratory distress. We do know that they have pneumonia, though. 2, the client with COPD on 4 liters of oxygen reporting difficulty catching air. This patient as well has a breathing problem, right? They have a breathing issue. But is this an unexpected emergent breathing issue? Not at all. Because we know that when you have COPD, does activity cause you to feel short of breath and tired? Is that something that we would expect if somebody with COPD went to the bathroom or ate a meal? Yes, I'm going to expect them to have some difficulty catching their breath after ambulating. Yeah, it's expected, right? And so we can't get too deep about it, because I think I did see a comment where somebody said, well, that the oxygen is a little high for this client. At this point, that's not the main focus at all, right? So that's a distractor there for you guys. And then 4 has a new condition. They have cystic fibrosis. Now, is there respiratory complications with cystic fibrosis? Yeah, they are going to be respiratory complications, because we know clients with cystic fibrosis have what kind of issues in the respiratory system? They have mucus buildup in their respiratory system. So it's common for them to have a cough, right? So everybody here has some sort of respiratory issue one way or another, but the priority is the client with asthma, because we are getting the evaluation points that there's no gas exchange at this time. All right, let's keep going. We are moving on. We're going to do a different topic. Our share goals, we haven't reached our share goals yet. We just need about 80 more share goals on Facebook. Let's go. Question number 3, last question. Here we go. A nurse is caring for a prima gravida in active labor and notes changes in the fetal heart monitor due to cord compression. Which of the following changes should she expect? Is it number 1, variable decelerations, 2, early decelerations, 3, maternal bradycardia, or 4, associative decelerations? Don't be afraid. Go ahead and put your comment down and smash that share button right now. We are looking for the nurses who know about prima gravida, active labor, and cord compression. Oh, if you have that quick facts, you better put the answer down right now, right now. All right, everybody here, report. And it looks like it's unanimous. It really does. It looks like it is actually unanimous in the answers, which I have never seen before. Is there one wrong answer? Oh yeah, okay, nope. It's not unanimous on YouTube. I thought YouTube all had the same answer, but there was one person who has not gotten the answer correct, and the same for Facebook as well. All right, so I see mostly 1s, but I did see a person pick, I think, 3 and 2 as well. So you got to get up on this content, guys. Get up on this content. This is basic content right here. And this is one of those things, like, you know, if you are not getting these type of questions right, then you got to hit the books. You got to hit the books. And I'm talking about the Quick Facts book, student workbook. The correct answer is variable decelerations. Variable decelerations. And let me show you guys this. I don't know if you guys remember, but last October, I did a Scary's topic NCLEX review, which I probably will repeat this coming October. But we went over topics that were scary, difficult, tough to understand. One of those topics was the fetal heart monitoring. And I don't know if you guys remember this, but remember when we talked about variable decelerations, you always can look, if you have to look on a fetal heart rhythm strip and you're called to interpret it, you will always be able to know when you're looking at a variable deceleration, because that drop in the heart rate will have a V shape. Remember? So it will actually look like, that looks like a V that my 5-year-old made, but it's a V nonetheless. Okay. So variable decelerations, they are associated with non-reassuring or bad things happening, right? So these decelerations can happen when a baby's umbilical cord is compressed, whether it's temporarily or permanently. This baby here, we would think that the cord was just compressed like temporarily because you see the deceleration, then the baby recovers and then it drops again. The baby's heart rate goes back up and then it drops down a little bit more. So this baby could be laying on their umbilical cord. They can be rolling on it. It could be wrapped around the arm, something in that manner. But this is a variable deceleration. If you have never seen it before, shout out to all the Remar nurses that participated in the scary NCLEX review. Okay, so you guys, all right, so we're gonna call Mark in. I don't know if you guys, I don't think we made the share goals today. I was looking for 150 shares, I only got 89 on Facebook, and that's okay because we can save the questions for it next week. I'm encouraging you guys to make sure that these kinds of topics get studied for your exam. And I don't know if I did, I'm going to jump back on. I don't think I did, and I'm giving you some time to share. I'm stalling, but I didn't do the slide for Winning Wednesdays. This Wednesday coming up, we will do Winning Wednesdays and we will be going over, I said we'll be going over the endocrine review. We'll be going over the endocrine portion. So that's diabetes mellitus. We're going to do Cushing's syndrome. We're going to do hypothyroidism, hyperthyroidism, Addison's disease. This is a free review that I'm doing from this book. So if you have this book, get it out. And if you don't have this book, I am actually creating a document. Mark and I are creating a document for you to use. Even if you have this book, you can still get the document. It's free. We're going to put it in the Facebook group. Remember, Winning Wednesdays happens in our Remar Nurse Facebook study group. So you want to get into that group. And so we're creating a document from this book. If you have this book, you can get it out. And I'm going to go over questions, all new. And we will be making sure that you understand this topic. Okay. So I'm super excited. Winning Wednesdays is this week. And remember, the time starts at 9 a.m. Eastern Standard Time. 9 a.m. Eastern Standard Time. This is a live Facebook review. So Mark will be putting that document out. Give him time to put it out. It's going to be free. You can print it off. You can share it, whatever. It's totally free. All right. I told him about.
Did they get the goal?
No, they didn't get the goal today.
Right.
I didn't get the goal today, and I had some sweet questions too, but that's okay. We're going to introduce you, and we're going to, and somebody said they were so happy they were coming back on.
Yeah.
All right. So we're introduce Mark, and he just has some things that we need to go over, housekeeping things as well. So, Mark Callion, are you ready?
Yeah.
You're looking. He's checking. He's verifying.
I'm checking.
Hey,
Trying to help y'all out.
I know he's trying to help you guys out. You can get into the group. People on YouTube, how you can get into the group? Go to Facebook. Look for Remar Nurse Study Group. Look for Remar Nurse Study Group, and you are able to apply to get in the group. I think we just asked 2 questions of you, so make sure you answer those questions, because if you don't answer those questions, then you will not get into this group. This is a real group. It is for serious nursing students that are ready to pass for real. All right. This is why we're doing the free reviews in that group. We want to make sure that everybody in that group is actively moving towards their goal. And you get in, you get out, you help somebody. That's the cycle that we want to create here for you guys. All right. So we're going to talk a little bit more about Winning Wednesdays here. All right. Yep.
Talk about Winning Wednesdays and the once in a lifetime NCLEX sale.
Yeah.
All right. I do want to make sure that we can verify exactly where we are. So I'm going to do this and refresh. I can't refresh that.
No.
Let's see. Just before I want to make sure that you guys have every opportunity to do all of your questions for today. How many shares are there? Just somebody put that up. How many shares are there? If you guys
help us, because sometimes we can't see it in real time.
I know it was like last time I checked, it was like 115.
Oh, really?
Yeah. So
wait for the circulation.
I'm trying to watch it on the
so I want to make sure.
Help us out.
All right.
Okay. Oh, 152.
152. So
oh,
they got it.
Oh, you guys got it. right.
Cool.
All right.
Listen, I will be back.
Okay.
How many more questions do you have?
I don't know. 3 more.
About 3 more?
Yeah,
roughly?
yeah.
Okay. All right, guys. Listen, I'll be back. I'm gonna tell you about the ultimate NCLEX
NCLEX
success package. I'm gonna tell you about the winning Wednesdays.
We're gonna keep going.
And I'm gonna tell you about the once in a lifetime NCLEX sale. All
cool.
right. I will be back.
Thanks, Mark. Here we go. All right, next question that we have after variable decelerations. Let's go, Remar nurses. Question number 4. A nurse manager realizes that she is having work-related challenges with some of the newly assigned nurses. The best way for her to approach this situation is to, let me read that again. A nurse manager realizes that she is having work-related challenges with some of the newly assigned nurses. The best way for her to approach this situation is to, number 1, seek advice from the director of nursing. 2, apologize to the staff who are unhappy with their assignments. 3, hold a staff meeting to address the unit concerns. Or 4, identify the source of conflict and meet with the affected staff. Okay, so here's a situation. You got a nurse manager and she realizes she is having work-related challenges with some of the newly assigned nurses. How should she approach this situation? And from what I see, the majority of people are picking 3 on Facebook and 4 on YouTube. Okay, 3 on Facebook. That's cool. Everybody's thinking 3 or 4, huh? Let me reveal the correct answer. The correct answer is actually going to be number 4. That nurse manager needs to figure out what is the source of the conflict and meet with the affected staff. Number 3 is incorrect because if the nurse manager holds a staff meeting to address the unit concerns, what kind of concerns could come up? People could have concerns about vacation time. They could have concerns about their schedule. They could have concerns about the uniforms. This is not going to be effective. We need to find out, okay, who has the problem and what is the problem? And then meet with that team to dead the problem, to finish the problem, okay? Yeah. So you got to be careful with that because it's very tricky. This is the nursing process. You need to do what? You need to do an assessment first, right? You need to do an assessment, and that does not include everybody. So I'm glad that we were able to unlock these questions because these are the kind of questions that you're going to come into your exam. And like I said, for a lot of you guys, even when you get it wrong, you're able to say, oh yeah, you're right. You're able to see it through the distractors. Let's look at another one here. What kind of question? Oh, I love this question. Oh, and if you're doing Winning Wednesdays with me, check this question out. All right, so here we go. The charge nurse is working on a medical surgical unit and must decide which staff member should be floated to the psychiatric unit. Okay. Is it the licensed practical nurse who has experience with mental health, the registered nurse who has experience with mental health, the registered nurse who has a child with cognitive impairment, or 4, the new graduate nurse who has 5 months experience? Oh, I'm making it hard for you guys today. Today is Critical Thinking Monday. That's what I should have named it. Critical Thinking Monday. Now, which staff member should be floated to the psychiatric unit? Oh yes, these questions get hard. But I'm doing this for a purpose. Everything works together for your good. All right. So they might seem challenging, but you guys are going to thank me later when I reveal the correct answer. But go ahead. Don't be afraid. And I see you guys putting the answer. I see the answer that you're putting down, and I know exactly why you're putting it down. I know exactly why you guys are mostly choosing number well, I don't know. It's kind of mixed. 1 and 2, right? 1 and 2. You guys are getting it down to 2, which is normal. And then you are stuck between 1 and 2, right? You're like, oh, I know it's 1 or 2, but I don't know which one of it is. Somebody pick, it could be 4. Okay. So who are we going to float? Who are we going to float to the psychiatric unit as the charge nurse? Well, I'm going to tell you. You guys know that with psych, you cannot just go on the psychiatric unit. It is best if that charge nurse sends somebody with a little bit of experience, right? You want to make sure who you send has experience. So, did that help you at all? Everybody's like, no, that did not help me. We already know that. Regina. Out of the licensed practical nurse and the registered nurse, who is the best for that charge nurse to send? And you guys, I know, and the problem is you guys are so kind-hearted that you are thinking, well, we need to send the very best. Okay. So actually with this situation, the person who you will want to send is the licensed practical nurse who has experience with mental health. And the reason why is because you want to make sure that the people on your unit are in the best possible situation. So yes, it seems great to send the registered nurse. Go ahead, take a whole registered nurse who can assess, right? Your registered nurse can assess, she can document, she can give IV medication, she can give blood. You're just going to give that away? No. If you have a licensed practical nurse who has experience in psychiatric health concerns, you give that LPN to the staff that is in need. Because if you send your RN, then the rest of the registered nurses are going to have to do everything that RN that you sent away could have been responsible for, right? But if you send an LPN, then you already know that the RNs can cover what the LPN does without having to take on additional responsibilities. So does that make sense? Okay. So when it comes to a scenario like this, you want to send somebody with experience, because that's always great. But then you want to look at the level of care. All right. The level of care that you're sending away, right? And so I'm glad that you guys are here today for this question, because you won't ever miss it again. And so that's the benefit of coming together and having these power sessions every week. All right. So I'm so glad we were able to get the shares and unlock this question. Now, okay, Pauline says, it makes perfect sense. It makes perfect sense now. All right, final question here. Okay, final question here. I'm looking at it because I rate these questions at night sometimes. All right, here we go. Question number 6. The nurse is caring for a newly admitted client diagnosed with a myxedema coma. The client has been moved to the skilled rehabilitation unit. Which is the best way to obtain information about the client? Number 1, the nurse should contact the healthcare provider. 2, the nurse should contact the unit charge nurse. 3, the nurse should contact the next of kin. 4, the nurse should ask the transfer paramedic for client history. 5, the nurse should utilize hospital records and the transfer report. You have a nurse caring for a newly admitted client diagnosed with a myxedema coma, and the client has been moved to the skilled rehabilitation unit. Which is the best way to obtain information about the client? All right. So here we are under the impression that this client is not able to provide their own information. So who do we get that information from? What is the best way? Remar nurses? I'm so proud of you guys. I really am proud of you guys. All right. So the correct answer is going to be The correct answer is going to be number, I'm bringing it up right now, number 5. Yes, the nurse should utilize hospital records and the transfer reports. Okay, we are wrapping up. Hey, you guys have been studying with me for so long. Do you understand that? All right, hospital records and transfer report. Good job. Good job. You guys got it. Okay, once in a lifetime NCLEX sale. Gotta hear this. We're gonna ask Mark to come in again and get that sale explained to you guys. Also, what we will be doing next. Don't forget Winning Wednesdays. Winning Wednesdays is coming up. And this Wednesday, okay, this Wednesday, we are going to get into that student workbook. We are going to get into that student workbook. So if you don't have this book, if you do have this book, perfect, because I'm going to take you, this will be like an advanced study session of this book. If you don't have this book, we will send out a document to you for you to print off and have by Wednesday morning. That is 9 a.m. Eastern time, 9 a.m. Eastern time. So I think you'll need to sign up for it. So I think when you register that you'll get this, but Mark will give me the details when he comes in here. Also, we'll probably just put it up in the Facebook group if you're already in the Facebook group. But he's coming in here now to talk about how you get the document for Winning Wednesdays. And again, we're going to focus on the endocrine in here. But when I was doing the questions, I really pulled in priority questions. I pulled in pictures. I pulled in pharmacology. So the Wednesdays will be, I'm going to talk about the content, but of course I'm going to incorporate more things. So if you have the DVD study package, this will be like an advanced study on the topic, because I'm going to talk about what's in the program. And then I'm also give you more information as well. So there's no reason for you guys to miss that event. All right. Okay, Mark.
What's that?
No, I see a great thing here. Okay.
Yeah.
Yep.
All right.
So you have the attention of the Remar nurses, and they want to hear what you have to say.
Cool. Here we go. All right. So this is the Winning Wednesday. It's coming up Wednesday. She just told you about that.
Yes.
So she has a new workbook for you. And so we're going to launch that today.
Okay,
all
cool.
Right, at 3:00 p.m. 3:00 p.m.
Okay.
Check back to the Facebook page. And also you can go to our website, remarnurse.com, and you'll be able to get the link to download the workbook for the Winning Wednesday.
Okay, so it's free. Right. Download it, share it. We want you to have it.
So the cool thing is this, if you already have your DVD self-study package, the information is taken directly from that. So you don't need to download the workbook if you already have your DVD student workbook like she showed you. But if you do not have it, if you're part of the Remar Nurse family, but you haven't gone all in, this is an opportunity to do just that. All right, so let me tell you a little bit about the name. This is called, the sale is a once-in-a-lifetime NCLEX sale. Once-in-a-lifetime NCLEX sale.
Pow.
All right.
Yeah.
The once-in-a-lifetime NCLEX sale. The longer that you've been out of school, the more that you're going to save.
What does that mean?
The longer that you've been out of school, the more that you're going to save. All right. So our goal is to be a blessing. And so we're just looking for reasons to have sales and to provide discounts and stuff like that. Sure. I mean, this could be like your favorite color blue, so I don't know. But whatever it is, we want to make sure that that you have an opportunity to get the package, that you're encouraged. Yeah. I was actually watching a testimonial video from one of our Remar nurses, and she said that literally she found out about Remar. She was kind of skeptical, and she didn't even really think that it would work. But since it was on sale, she actually went and got it.
Oh, I remember.
And, yeah. And she just got it because it was on sale, not because she loved the content or studying Regina. She's like, it's on sale, I might as well get it. Yeah. And then to show you that she was telling the truth, she said she didn't even open the package that she bought for like 5 to 6 months after buying it. Yeah. Right. And she was a repeat tester, international student. Yeah. Ordered it, didn't even open it, didn't even crack it open until 5 or 6 months. Now she attended the Remar Nurse University, I believe in LA. She came there, she brought a whole crew, took photos with Regina, with myself. Okay. She passed NCLEX, and now she's like, this is the best thing ever. So we want to give you guys this opportunity. It's the once in a lifetime sale. Because of this, if you are testing for NCLEX RN, how many times do you need to take this thing?
One time. Yeah.
One time.
Yeah, one time.
So you only need this sale one time.
Oh,
once in a
I get
lifetime.
It. Oh,
right?
I get it.
And this decision that you make right now is going to change your life forever.
Yeah.
Many of you guys don't know this, but we are fortunate enough on yesterday. We had a very special occasion. It popped up in my Facebook timeline of all things that yesterday was our 8th year anniversary from the date that I proposed to Regina.
Mm-hmm.
And when I proposed to her, I asked her a question that would change her life forever. Yeah. And fortunately, I was blessed enough, and she said yes.
Yeah.
And she said yes. Mm-hmm. And so I want to ask you a question. Are you ready to pass NCLEX? Oh. Are you ready to go all in? And if you say yes to this and you mean it, you're good to go.
Yeah.
All right. So the way the sale works is this. For every year that you've been out of school, mm-hmm. you're going to save $10 off of the ultimate NCLEX success package.
Wow.
Yeah. So if you've been out of school for 10 years, you're going to save 10 times 10. If you've been out of school, also, you know what? Some people are still in school right now. We're looking out for you too. So everybody's going to save at least $20, right?
Right.
I don't care if you've been out 1 year, 2 years, you're going to save at least $20. If you've been out 3 years, you're going to save $30. If you've been out 4 years, you're going to save $40. Wow. If you've been out 5 years, you're going to save $50. We're taking it all the way up to not 10, not 11, not 12.
What?
Not 13. Nah. Not 14.
Yeah.
15 years out of school.
Wow. And that's for the ultimate package. And that includes everything. So the ultimate study package, that includes the 4 books, the 4 DVDs. You also get the question bank book and the quick facts DVDs. That comes with the boot camp, the Monday motivation, everything we do for you guys. Like, this is the ultimate. This is everything that I have created. It is the ultimate package. And it is available, and it's something that we've just done. So you literally get all of the products. You don't have to say, oh, well, do I need this or do I need that? Like, this is amazing. And I'm just really, I'm really happy that we're launching it in this way. We have testimonials from nurses already.
In fact, these are just testimonials from people that were in the broadcast today.
Wow.
Right?
Wow.
So Nurse Real White, WHYTE, 10 years out of nursing school from Ghana. Passed NCLEX.
Okay.
Congratulations.
I meant congratulations. From Ghana.
Yeah, we had Muhammad. Muhammad Al-Gahanan, passed NCLEX. Shout out to Nurse Chantel Cooper, passed NCLEX.
Absolutely.
We had Nurse Angelisa. She hasn't passed yet, but she said she's been out of school 15 years since 2014.
Wow.
This sale is really going to benefit you, right?
No, 2004. Yeah,
I'm sorry, 2004. Mm-hmm. And so she says, I need that package.
Well, this is your week.
Right. This is the time. And so we want to make sure that it is accessible for you. Mm-hmm. We want to make sure that you're able to go all in. And the cool thing is that one thing that Remar does better, one thing that Regina does better than anybody else, the #1 NCLEX instructor in the world, is that she helps students that have been out of school for impossible lengths of time. We have a testimony here from Nurse Misty Rose.
Let's see.
And so it says, hi, Regina, to God be the glory. I'm humbled in letting you know that I'm finally past NCLEX. She passed in August of last year. Nailed it in 75 questions. She wanted to share her success and all the positive encouragement and consistent reminder to never give up. Scrolling down to the bottom, she says that after 24 years graduating from nursing school, 24 years graduating from nursing school, I'm proud to say that I did it, and I'm officially a USRN. 24
years. Oh my goodness. That is amazing.
Check out this next one from Nurse Marcia. Said she's new to the group and just wants to say thank you, Regina. I graduated PN school 18 years ago.
Oh my goodness.
18 years ago. She failed her NCLEX twice. She stumbled upon the videos on YouTube. So when we tell you guys to share and make sure that you subscribe,
that's true. We're not just saying just share just to share. Like, there are people that come in contact with us because a friend, because of friends share.
Just because
this is like life-changing.
Absolutely. In fact, speaking of one of those people who shared, this is the next one. He says, so my college best friend, Jaira Sanchez, recommended you guys, Remar, to me after she passed her exam this year also. And oh my God, I am so blessed. Down to the end, says she got the DVD self-study package. And she said the spiritual guidance is awesome. It's the reason why she passed. She was out of school 8 years since she graduated, and she passed it in 75 questions. She says, Remar has helped me with a great deal, and you can never go wrong when you walk with God with this journey of passing NCLEX. Wow, we see testimonials coming up now and just people saying that they're excited to get back into it. They have Hope Belinda. She's been out of school for 21 years.
Wow.
Shout out to you that you're still here. It says going back now to take the exit. I mean, you have a journey ahead of you, and we want to be with you on that journey. So if that's you, if you've been out of school,
this is your time.
Share, tell somebody.
This is it, man. This is it. This is no excuses August for you guys. With this amazing, how long does it sell for?
The sale is going to be until Friday, August the 16th.
Oh, so
wow. You have the Winning Wednesday this week. You have the Winning Wednesday next week. And then 2 days after that, the sale ends. Now, listen, for the Winning Wednesdays, that is inside the Facebook study group.
Right. So we won't be on the page.
Yeah. It's not on the page. It's not on YouTube, guys.
No.
So if you don't have Facebook, get Facebook activated just for the for getting Regina's lives.
Yes.
And then you can do whatever after that. You don't have to talk to your friends. You know what I'm saying? You go incognito.
Yeah, because they're studying.
But get what you need to pass. All right.
Absolutely.
So listen, get your materials, get inside the Facebook study group. So if you have quick facts, if you bought anything from Remar, you can get inside the Facebook study group. She does the free content on this side, but we provide supportive content for you after you've purchased the programs, a little bit more on the inside the Facebook study group. So you want to be a blessing. Winning Wednesdays is a way to do it. The ultimate once in a lifetime sale is a way to do it.
Oh my
You're
goodness.
going to get everything that Remar has to offer.
Pow, the whole package, the whole everything, amazingly amazing. This is just one student's dedication. I like how they have the calendar, 6-week calendar up on that wall, as well as the notes that they take from the program. I mean, this is that deal right here. And I mean, this program, it's what I take with me when I travel all over the world, like all over the world. We'll be in London in 2 weeks. And we're going to take this package with us. Like everywhere we go, we speak, we help nursing students everywhere on this planet. So we want to be a blessing to you guys. Check it out. Check it out, man. I'm super excited.
So check back to the page. 3:00, we'll have it up, a live link for you, 3:00 p.m. just in a few hours. Also, I want to give you the phone number, guys, to call. You can talk to our staff at Team Remar.
Sure.
And they'll make sure that you're able to get your deal for the ultimate NCLEX package. Once in a lifetime sale. Just tell them how long you've been out of school, and they'll make sure that they get the right programs for you. The phone number to call is 855-625-3966. Again, that's 855-625-3966, and talk to one of our staff on Team Remar, and they will make sure that you get exactly what you need, tell you how the program works, let you know when you'll get your package once you place your order, and make sure that you have the encouragement and everything that you need to get this done. This is a once in a lifetime thing because you only need to do this once, guys. And we're going to take care of this for you.
So once again, thank you, Mark, so much. Once again, Winning Wednesdays. This week, we are launching our Winning Wednesdays. And you know what? One thing about Winning Wednesdays is just not one Wednesday, but we are going to do back-to-back Winning Wednesdays. So it'll be August 7th, this Wednesday. And then we're going to do part 2 the next week to finish you guys off for this month. So this is a free opportunity to do an advanced study session with the number 1 NCLEX instructor on the planet. And I'm coming right from the student workbook, your DVD student workbook. So tell your friends that this is the time that we are serious about passing our NCLEX. All right. So with God, it's all possible. It's all possible. Don't forget, guys, we love to say this. It's like our favorite thing ever, ever, ever. And we tell you guys this all the time, but it's essentially, we can, we will, we must pass NCLEX. Somebody in the back didn't hear it. I got to say it again. We can, we will, and we must pass NCLEX. Thank you guys so much. Thank you guys so much for joining me today. I appreciate it. I truly appreciate it. And I hope to see you guys on Wednesday this week. And after that, we come back around for Monday motivation again the following week after that. Don't forget, you can also check out all of these episodes on Remar Radio. It's our podcast, and you can get it on Spotify and iTunes. Some people, if they miss Winning Wednesdays and they want to know where did it go, it went to the podcast. So check out the podcast, Remar Radio, as well. Thank you, YouTube. Thank you, Facebook, for joining me. And I will see you guys soon. Bye-bye.